The longevity paradox: why ancient health practices need a scientific upgrade in the XXI century. Hello, dear friends. Welcome to our lecture. My name is Lena Subk. I am a practicing dentist periodontist and an expert in systemic health. Today, I want to address a crucial question and evaluate whether ancient health protocols, historically utilized for wellness, remain appropriate for our modern society. We will objectively examine what elements of this traditional knowledge continue to demonstrate clinical efficacy and what components we must strictly adapt to align with contemporary evidence-based science to prevent physiological harm. Specifically, we will analyze anti-inflammatory dietary frameworks, the biochemistry of polyunsaturated fatty acids, and modern clinical views on caloric restriction. Given the overwhelming volume of conflicting data available online, it can be challenging to distinguish scientific fact from marketing narratives. Moving past superficial trends, we will thoroughly analyze these mechanisms from the dual perspectives of medical biochemistry and evidence-based medicine. When discussing the reality that our modern environment introduces unique metabolic challenges, a common and logical counterargument frequently arises. People ask, if lifestyle patterns were fundamentally healthier in antiquity, why did our ancestors frequently fail to survive past the age of 40, while modern life expectancy regularly extends into late senescence? Does this mean modern concerns regarding systemic health degradation are merely a myth? Let us deconstruct this assumption. In this ongoing debate, two distinct epidemiological metrics are commonly conflated: the average life expectancy of a population and the actual quality of individual physiological health across that lifespan. Low life expectancy in antiquity was primarily a result of statistical mathematical distributions driven by catastrophic infant mortality rates and deaths from acute external factors. These included uncontrollable infectious diseases, a total absence of antibiotic therapies, trauma, localized famine, and parasitic infections. The ancient world was intensely hostile to the human organism, and idealizing the baseline health of ancestors who suffered from extensive skeletal, infectious, and severe periodontal pathologies is scientifically inaccurate. Today, due to monumental advancements in tertiary medicine, we live significantly longer. We can eradicate dangerous infections, resolve acute surgical emergencies within minutes, and pharmacologically manage chronic conditions. However, comprehensive international data, including the global burden of disease studies, demonstrates that the growth of healthy life expectancy, or health span, is unfortunately lagging behind the expansion of absolute lifespan. We are witnessing a stark rise in non-communicable civilization-driven challenges, including clinical obesity, metabolic syndrome, and type 2 diabetes, which systematically manifest due to sedentary lifestyle patterns and an over-reliance on ultra-processed food matrices. Consequently, when a modern individual attempts to rigidly and fanatically replicate ancient ascetic traditions, such as the Ekadashi fasting protocols described in historical texts, by fully abstaining from both macronutrients and hydration for 24 hours, the organism may experience extreme physiological distress instead of the anticipated therapeutic benefit. 5,000 years ago, brief periods of involuntary fasting were an evolutionary norm. Ancestral metabolic flexibility, meaning the capacity of the organism to transition smoothly from glucose oxidation to lipid oxidation, was continuously reinforced by high physical activity and synchronization with natural circadian rhythms. Under those specific evolutionary pressures, moderate caloric restriction effectively stimulated adaptive cellular signaling pathways that contemporary science actively investigates within the framework of autophagy. However, translating these extreme practices directly into the routine of a modern citizen demands severe clinical caution. Full fluid deprivation for 24 hours induces acute dehydration and alters blood viscosity parameters. According to consensus statements from leading cardiovascular and cardiometabolic associations, this creates an unjustified and hazardous burden on renal filtration pathways and the cardiovascular system, particularly if the individual harbors latent metabolic dysregulation. Furthermore, acute starvation triggers the hypothalamic pituitary adrenal axis, causing a pronounced surge in counterregulatory stress hormones, including cortisol. While this represents a healthy evolutionary adaptation under acute threats, superimposed upon pre-existing chronic psychonoetic and emotional tension, it can exacerbate anxiety states, disrupt sleep patterns, and induce subsequent compensatory hyperphagia. When evaluating contemporary nutritional frameworks, it is imperative to rely upon the balanced consensus of clinical science. For instance, structured anti-inflammatory food lists featuring berries, leafy greens, cruciferous vegetables, avocados, and extra virgin olive oil are fully validated by the European Society of Cardiology and the American Heart Association as cornerstone components of a cardioprotective Mediterranean dietary pattern. However, evidence-based medicine universally prioritizes individualization. The official clinical guidelines of the American Diabetes Association explicitly mandate that there is no singular, universal diet appropriate for the entire population. While for highly active individuals, whole grains served with every meal represent an excellent source of complex carbohydrates and dietary fiber, for individuals exhibiting documented carbohydrate intolerance or severe insulin resistance, the total glycemic load must be dynamically optimized to ensure stabilized postprandial glucose control. The same scientific precision applies to food intolerances. When managing specific gastrointestinal presentations, such as irritable bowel syndrome, clinical protocols dictate utilizing a symptom-oriented, highly personalized approach rather than enforcing generic, unproven exclusions of entire nutrient groups like nightshades or soy, which inherently remain nutrient-dense elements of human nutrition. A paramount aspect currently evaluated in nutritional biochemistry is the balance of polyunsaturated fatty acids. The International Society for the Study of Fatty Acids and Lipids confirms that technological processing in the modern food supply has exponentially increased the dietary presence of omega-6 fatty acids. Concurrently, modern nutritional science has pivoted away from the absolute demonization of omega-6 as an isolated, direct driver of systemic inflammation. Today, international researchers agree that the primary clinical objective is not the aggressive restriction of dietary omega-6, but rather the correction of the pervasive systemic deficiency in long-chain omega-3 fatty acids, specifically eicosapentaenoic and docosahexaenoic acids. Plant-based sources, including flax or chia seeds, contain the short-chain precursor alpha-linolenic acid. The enzymatic conversion efficiency of this precursor within the human body, governed by the fatty acid desaturase genes, is biologically limited and exhibits extreme individual genetic variability. Therefore, to safely maintain healthy lipid metabolism and optimize the biophysical composition of cellular membranes, evidence-based medicine recommends the regular consumption of wild-caught marine sources or the utilization of highly purified nutraceutical complexes. For individuals adhering to plant-based or vegetarian lifestyles, marine microalgae oils serve as a direct, bioavailable alternative providing therapeutic concentrations of preformed eicosapentaenoic and docosahexaenoic acids. Furthermore, to enhance the absorption of lipid-soluble compounds in individuals presenting with altered digestive physiology, such as compromised biliary flow, contemporary science utilizes advanced self-emulsifying drug delivery systems and micellar technologies. These pharmaceutical developments improve the bioavailability of lipophilic nutrients, allowing lipids to interface efficiently with the aqueous environment of the gastrointestinal tract, thereby facilitating natural digestive processes. These delivery systems do not replace primary medical therapies, but they serve as highly effective, clinically validated tools for targeted nutritional support. What definitive conclusion can we draw from this comprehensive analysis? Evidence-based nutrition teaches us to reject radical protocols, alarmist marketing narratives, and the unscientific romanticism of antiquity. The ancient world was not an era of perfect wellness, and human physiology faced severe environmental and infectious threats. Yet, our modern lifestyle requires equal scientific vigilance. We must capture the most rational elements of historical traditions, specifically the focus on whole, unrefined plant matrices and periods of structural moderation in food intake, and integrate them directly with modern diagnostic precision and personalized clinical metrics. We utilize a balanced diet as our absolute foundational infrastructure, and we apply high-tier nutraceutical technologies strictly as a rational, objective methodology to manage individual biochemical deficiencies. Only this sophisticated, evidence-based synthesis allows us to transform the additional years of life granted to us by modern tertiary medicine into a lifespan characterized by genuine vitality, metabolic health, and structural energy. I have synthesized this presentation for you based on the latest verified data from the fields of metabolic medicine and clinical nutrition. Please ensure you subscribe to the channel, as we have an extensive array of verified, rigorous scientific data coming your way, completely free of pseudo-scientific myths and commercial exaggerations. If you wish to comprehensively evaluate your current metabolic status, structure a scientifically validated nutritional framework, or undergo precise biomarker analysis, you are welcome to contact us for personalized consultations and individual health management programs. Thank you, and I look forward to our next meeting.